Everyone, and welcome to today's episode of In the Know. In our critical health issues segment today, we will be discussing health disparities. Health disparities is a serious issue in our nation, often ignored but very prevalent. Health disparities are the differences in health outcomes that are closely linked to the social, economic, and environmental disadvantages, often driven by environments in which individuals. So the first goal of the HHS Action Plan is to transform healthcare. They'll do this by taking our current healthcare system and then transforming it into a more high-value healthcare system. They will do this by making sure more Americans are insured through programs such as Medicaid, CHIP, Medicare, and other health insurance programs. Also, making sure that everyone has a primary care doctor that they would see regularly. The second goal of the HHS Action Plan is to strengthen the nation's health and human services infrastructure and workforce. By strengthening the health and human services workforce, it involves addressing the critical issues of the healthcare field, such as the shortages in the primary care providers, nurses, long-term care workers, and even behavioral health therapists. Strategies to address these barriers are to provide more interpreters to bridge that language barriers between the patient and the providers, improving the quality of patient-provider interactions in clinical settings, and improving cultural competence education and training for healthcare professionals. The third goal of the HHS Action Plan is to advance the health and safety and well-being of the American people. A lot of the reason why these people are disadvantaged or have poorer health conditions is their environments. So the HHS aims to create environments that promote healthy behaviors to prevent and control chronic diseases and the risk factors that requires renewed commitment to prevention, with an emphasis on strengthening community-based approaches to reduce high-risk behaviors. The fourth goal of the HHS Action Plan is to advance scientific knowledge and innovation. While scientific advances have improved the longevity and quality of care for life in America, these gains have not been experienced equally throughout the racial and ethnic minorities. Advancing scientific knowledge and innovation can improve patient-centered research in areas such as prevention, screening, diagnostic and treatment services, and strengthening the existing information systems to reduce and improve the quality of health, public health, and biomedical research. But these efforts must benefit all populations in order to work for America and as an entire entity. And last but not least, to tie it all together, goal number 5, increase efficiency, transparency, and accountability of HHS programs. Promoting better collaboration and streamlining efforts can improve the efficiency of the HHS program. Addressing the racial and ethnic disparities in an efficient, transparent, and accountable manner that will require better coordination and integration of the minority health infrastructure and programs. Using transparent measures can help the department hold itself accountable. Other HHS open government activities, such as the Community Health Data Initiative, a major new public-private effort to help people understand health and healthcare performances in their communities and spark and facilitate actions to improve performance, will promote local applications of measures. Hi everyone, we have Elizabeth on our show and she'll be discussing with us access, cost, and quality as it relates to healthcare disparities. Elizabeth?
If a politician tells you that they can decrease costs and not affect the quality of healthcare, they'll be lying. The cost, quality, and access of the healthcare system, better known as the Iron Triangle, is the different parts of healthcare. You cannot positively enhance one part without negatively affecting the other.
Okay, so how so? What do you mean by that?
For example, you can't decrease the cost of it without increasing the access. So once the access is increased, you're going to decrease the quality with so many different individuals now joining the healthcare system.
Oh, okay. Interesting.
And a positive functioning iron triangle is able to identify the different disparities within the healthcare system, social and racial. For example, we found social disparities when it came to income with smoking and obesity. People with lower income were 27% more likely to smoke and 34% likely to be obese. On the other end, low income individuals, they only had a 12% chance of smoking and a 25% chance of being obese. So the numbers were dramatically different. And change has to occur to better fix our healthcare system. For example, African Americans are dying from heart disease 30% more than white Caucasians Americans. So those numbers are outrageous.
Okay, really, they are.
Yes.
Hi, everyone. Our second guest of the day is with us, and this is Justin Bennett. He'll actually be discussing with us the Affordable Care Act and its effects on healthcare disparities in our nation. Justin, what is your outlook on this?
Well, as we know, access to care has been a big problem in healthcare the past few years. So with the Affordable Care Act being implemented, it has two provisions to eradicate these problems. The first will be Medicaid expansion as well as health insurance exchanges. Before the expansion of Medicaid, typically about 50 million Americans were being benefited. Well, after the expansion in 2014, that number will roughly rise about 16 million Americans by the year of 2019.
Okay. All right, interesting numbers. It's actually a lot of people, 16 million. Okay, Justin, so you also mentioned the health insurance exchanges, right?
Correct.
How are those being used to eradicate healthcare disparities in the nation?
Well, in order to expand coverage, as I stated before, the ACA has implemented exchanges, also known as marketplaces. In these marketplaces, people can go to determine their eligibility for financial assistance as well as purchase health insurance. There will be three types of marketplaces that will be offered. There will be a federally facilitated marketplace, a state-based marketplace, and a state partnership marketplace.
Okay, interesting. Okay, Justin, those were some interesting points of the health insurance marketplace and the Medicaid expansion. What barriers to care have been lifted with the ACA in place?
One barrier that has been removed has been dealing with children. Children can now be covered under their parents' insurance until the age of 26. Another barrier that comes to mind, health insurers can no longer defer patients' access to care if they have pre-existing conditions.
Okay, that's interesting. Okay, Justin, how would you say that everything that we've discussed today with the Affordable Care Act helps to reduce health disparities in our nation?
Well, with the Medicaid expansion into place, you can see the numbers have changed. The rate of insured African Americans and Latinos has risen 7% as compared to 3% for whites. With children being able to be covered under their parents' insurance until the age of 26, it gives children that has been grown up and raised in underserved populations as well as target populations adequate time to be able to grow up and afford health care. When it comes to patients with pre-existing conditions, numbers have shown that most patients with pre-existing conditions came up in or live in underserved populations. So with them no longer being able to be denied health care, this gives them more opportunity to receive the care they need.
Okay, well that's actually very interesting. Hi everyone, well today our next guest is Cliche Cook and she'll be talking to us about the Zubik versus Burrow case.
Hello everyone. The Zubik versus Burrow was a Supreme Court case that dealt with the ethicality of the use of contraceptives directly in the avenue of religious freedom. Bishop Zubik served in the plaintiff role in the case with General Burrow being the defendant. This case was also criticized by some because it was thought that the Supreme Court overstepped their bounds by interfering with religion and freedoms associated with them.
Okay, well that's understandable. I can understand both arguments there. Cliche, well those are some actually great facts about that case. How would you say that this Zubik versus Burrow case relates to the health disparities issue that we're experiencing?
I would say that this case deals with socioeconomic display in the realm of healthcare. So since there has been legislation that protects the rights for a woman to choose to use contraceptive services, a recent push has been made to make the process harder for these services to be available. So since many minority of women of lower socioeconomic background depend on government funding services and institutions such as Planned Parenthood, this has a particular adverse effect on these women. This disparity can cause social programs such as increased poverty and co-occurring issues accompanying poverty, such as issues even mortality.
Okay, good afternoon, everyone. Today, our second to last guest is Dexter Holmes, and he'll be discussing with us cultural humility, or cultural competence as it is also called, and as it relates to healthcare disparities in our nation. Okay, so for our guests who do not know what cultural competence is, Dexter, could you tell us about it?
Well, cultural competence is it encompasses an organization's ability to kind of alter their practices in order to provide quality healthcare to people who may have differentiating cultures or practices and beliefs.
So Dexter's going to explain to us how cultural competence will help to eradicate the issue of health disparities in our nation. Dexter?
Well, when it comes to health disparities, being culturally competent is extremely important. We live in a day and age where our surroundings are currently changing, so we're going to be interacting with a lot of different cultures and like ways of life. So as an organization, we have to further our cultural competence by offering adequate training and placing more importance on diversity in our hiring process.
So, to conclude tonight's episode of In the Know, we've gained a lot of knowledge of health disparities and how it's such a huge issue across our nation. We've learned not only does it affect disadvantaged populations, but it also affects more than half of the minorities across our country. We also explored how we use the Iron Triangle to help identify health disparities within two different groups. Recently, the HHS has implemented 5 rules that should help reduce some of the issues of racial and ethnic disparities. In order to resolve some of the issues in health disparities, the SEA decided to put some provisions into place, such as Medicaid expansions. These provisions are set in place in order to help some of the minorities reduce some of the different disparities that they encounter. Being culturally competent relates to health disparities because when you're culturally competent, you can provide better quality service to those from different ethnic backgrounds and cultures when you can better relate and understand to their culture.